Welcome to another OCD Recovery Instagram Live. I thought I'd come on here and do some questions and answers on your OCD. So if you'd like to put any of your questions and answers in the comments below, I will cover those now. Last couple of videos I was doing different topics, talking about connecting with friends, talking about what's involved in the OCD recovery journey, why it stays stuck, why we stay sort of in a locked on cycle and feel like we can never get out of it and like nothing's working. So there's a lot of that being covered. It's a topic that I often cover, sort of why are we still stuck? Why is it not releasing? Because the problem with that is it's like the key of OCD awareness. If people don't realize why they're still stuck or have any idea of what's going on, they feel like they're kind of treatment resistant, because all they hear all day long from every single person they go to is thoughts are thoughts, you are just thoughts, your thoughts have no meaning, just leave thoughts there. And when they can't leave them there, then they think they're really screwed and they're never going to get better. So I think the main thing that you've got to think about is, just because you have read in every book on OCD, leave thoughts there, thoughts are there, change your relationship with thoughts, and it hasn't released, that does not mean you're treatment resistant. That doesn't mean you're not going to get better. What it means is that large amount of people that had milder OCD that worked for, and so they haven't gone into it enough, and there's a large population that is still stuck with OCD. Very much the case for me, very much the majority of the case for most chronic OCD sufferers. So it's not a case of you're not getting it, you're not grasping it. It's because it's just never ever been put down in paper and explained properly, because people didn't understand, because unless they had OCD, they didn't understand. And even if they had it, so few people had ever got recovered that barely much was written on the topic. Albert Ellis did lay it out through the unconditional self, life and other acceptance, but it was never properly carried on. And that alone isn't recovery. There's more elements to it than that, in terms of distancing yourself with the thoughts, rightfully so, like let's talk about, but how that comes into play with acceptance and that whole sort of unlocking OCD, where it sort of like feels like an octopus locking around your brain and you've got to peel back each leg. If you watch the video that I did on the last Instagram Live, the one from about a couple of days ago, it goes into that in great detail, the one on how to recover from OCD. So if you go onto our YouTube channel and go on that, why recovery hasn't worked and why you're still stuck, that video that I did, one of the last ones, that really covers it, because that is what this is all about. Understanding why we're still stuck. The brain doesn't let you off the hook with the 0.0001% risk. It keeps on clinging in there. Okay, let's have a look. Hi Rob, do you have any opinions on psychedelic therapy like mushrooms to help break OCD? It's not going to break OCD. What it does is it helps create a bit of distance with the thinking. But psychedelics, psilocybin and so on, low dose of psilocybin is something that is being brought into therapy in the next few years, but it's definitely not a place now to be getting involved with. It's going through a lot of tests, going through a lot of medical research in relation to it. Do I think it's going to be change a lot of the situation of how drugs are used in the world? Absolutely. Do I think that psilocybin is going to become a sort of a main thing for a lot of people? Yes, absolutely. Will I get involved in it? Yeah. I definitely. I'm already supporting companies that are developing psilocybin for treatment of anxiety, but it's going to be used for a lot of things. It's going to be used for addiction, treatment-resistant depression, and so on. So I think it will play its part. But it's like Alan Watts says, using drugs like that. It's like looking in a microscope for a second. You use it just briefly to get a change in insight. You don't use it so regularly, and that's how it will be used in a safe setting. Now is definitely not a safe setting, and not something that I'd advise. But yeah, I think it will be. I'm supporting and helping fund some of the places that are doing psilocybin work for anxiety, and I think that's going to be. I think that's going to be the future. I think it's really going to be the future. I think one second. When I say I think it's going to be the future, I think that it will have its part in amongst other meds. You'll still have SSRIs, but then they'll use that as well. Do I think it's going to be a game-changing drug for OCD? No, I think it will help change things. I don't think it's going to be any form of cure. By no means. It just helps give an insight into acceptance. Do you need that now? No. With everything that we do, you can recover now, but it will help that road. Okay, so it will help with an insight, a change in perspective. Helps with that. So I think that will be very useful. But I think there's going to be lots of other things, like I think that the neuralink that Elon Musk will probably bring in, or someone else brings in a version of, or whatever, will become where you see OCD cured. Do I think that's in the next 10, 15 years? Yeah, I do think so. But you can't say, that's very difficult to say with those things, how long those things actually end up taking. You know, we've got a lot of other challenges in the future that are coming along for the ride with AI and dangers of AI, the singularity and so on. There's a lot of complexity. How this future is going to be a very weird place. I think Neuralink will definitely be I think once they can do that, or CRISPR and so on for DNA changes, where they can sort of get rid of OCD, or they can do very specific drugs for targeted parts of the brain, but specifically with Neuralink, where they'll be able to sort of connect into a computer, find the anxiety and OCD and sort of bypass it, or get rid of it that way. I think that would be the cure. Do I think that'd be in the next 10, 15 years? Yes, I do. Do I think that if I had a child that was 1 today, what would I think about them having OCD in the future? I think, well, their life's going to be so different because of the technology that will advance. I mean, I don't think OCD is going to be something that's going to be around for the next 50, 60 years. Maybe I'm wrong. I doubt it. I think it will be something that's eradicated through technology. But I think that with so many things are changing like that. But it's very hard to put a time scale on those things. To work out how long these things will actually take is very difficult. So yeah, that's a bit about the future of OCD. I think virtual reality, well, I'll talk a bit about it now that I've got going on that topic, and then I'll come to these question answers, which I plan on doing today. And then you've got virtual reality, which will be very specific in relation to exposures, being able to target using virtual reality, very specific exposures that are hard to target, certain existential fears, certain POCD fears, and so on. So I think that will be a big game changer. I think overall you'll see combinations. You'll see virtual reality probably used with meds and used with sort of brain implants all together, combinations. So it's being like hit from so many angles. And I think that's when you're then going to see OCD and these sort of more stubborn anxiety disorders disappear, because they'll be targeted from so many angles. I mean, if you only look at the time frame of us, we've just been so far. We're using alcohol in the past, we were using high doses of Xanax, which led to massive addiction. We then used SSRIs, but which have their limitations, but obviously were quite a game changer, but didn't lead to a cure. But then the next role of things is going to be, hopefully, a big changing moment, because there's so many things that they'll be able to do there that have been boundaries, because they knew so little about how the brain works. I mean, you've only got to look at the history of SSRIs and benzos. I mean, you're talking very short time period in the length of sort of history. It's a very, very short time period. So you imagine where things are going to move in the next 20, 30, 40, 50 years. It should be incredible changes. I mean, like we see incredible changes in science all the time. Just the other day, there was a huge breakthrough in relation to proteins and genes and sort of all of that situation in terms of uncracking things the unfolding of proteins that they hadn't seen for that they'd been trying to crack for years. But unless you're sort of reading those things, you wouldn't see and understand what's going on there. And actually, with that particular situation, that was only this week. I've been so busy with work, I haven't had a chance to read about it. But there's so much stuff to look at in terms of development of science, of what's happening, and so many breakthroughs in so many areas. You've only got to look at cancer survival rates and how much those have changed. But then for certain parts of the body they haven't, like the pancreas, but other parts they have. But you can see that they're moving obviously very fast in the right direction. And I think that, I'd be pretty confident there's a cure coming in the next 2 decades, definitely. And when you think of the ages of people, and how young they are and when that will come out, it's looking very optimistic. However, we can't rely on that. That's why we have to do everything we do, and all this changes on perception and everything. All of this it makes a significant difference to our whole lives. I mean, we can't just wait for sort of our brains to be backed up on a computer, or for us to sort of implant memories and education and change IQ by computer. We've got to do the work now in the meantime to make those changes whilst we're waiting for those scientific changes to come into place. But I mean, it's very optimistic, and there's a lot about that, and I will go into that in great detail and sort of plan videos specifically for those subjects, talking about what I see happening and changing. At the moment, I'm at the company that I think is going to be pretty good for psychedelics in the future, for psilocybin, and for changing that, is MindMed, based in New York. I think they're going to be a good company. There's a few of them that are sort of in a race to bring out psilocybin treatment. One of them's a company backed by PayPal's owner Peter Thiel, and the other one is one of the others is MindMed. There's about 3 or 4 of those companies that are in a run for that, but they're all targeting different things. Some of them are targeting ADHD, some of them are targeting treatment-resistant depression and addiction. That company MindMed, which I think is a great one, is something that they're going to be targeting anxiety disorders. They're going to be targeting addiction. And I think it's going to be very, very interesting. At first, when I read about psilocybin, I was anti at first, because I thought you'll get too many people sort of chancing it and going for it. Hence why I don't recommend it now until these companies do it in a safe setting. And I was sort of anti it. I'd seen, obviously there was a lot of things coming out about CBD and so on, and people take that, but it's not in the same realm as what psilocybin's going to do. This is going to be something that will be able to make a somewhat significant change in the way that we see things, our perspectives and acceptance, and definitely a significant change. Won't lead to OCD recovery alone, but will play a significant part. And I think that this is going to be an interesting. This is going to be an interesting area for what's going to be happening with OCD. Virtual reality, I was very, very much believed in before, and I still believe in now. But I think you're going to see virtual reality coming in more, and it's going to play a great part, as it does with PTSD. It has great results with PTSD at the moment, with people being able to go back to war situations in wars and so on, view that all through the virtual reality experience. I think it will be very effective. I think it'll be very good, but I think it's when these things come together in a combination that you will see real things changing. And there's just so many ways to target it. It's like with what we do. People come in and they've had. I work with the sort of most severe cases of OCD on the planet. So people, as well as all the people that have just got sort of chronic OCD, but I also work with the most extreme cases, because people come to me who've been in hospital after hospital, centre after centre, stuck for 20, 30 years. And so, I work with lots of people in that situation. And you can't just come at these things from one angle. That's why people who are primarily using just mindfulness and sort of changing our relationship with thoughts, it's like trying to put a band-aid on a broken leg. It doesn't do it to put a sticking plaster on a broken leg. It doesn't work like that. There's a lot to it. You've got to come at it from a lot of angles. You've got to look at it like a sort of pneumonia and trying to, you're not trying to treat that with a vitamin C tablet. You've got to have a good method of things to do to keep everything working and ticking over. And that's what the way is with OCD. You've got to think of, right, we've got to get under their fears. Okay, they're finding that hard. They can't really accept that. Okay, come up with an exposure, see if that will help with the perspective. Okay, that's not helping. That's helping them so much. Okay, let's ease off that, get them to help change their relationship a bit and give them an understanding of their whole OCD and what's going on and how it's sort of interacting with them. Okay, now we're doing that. And then we're going to be looking at We're going to be looking at their fears again gradually and going through a lot of reading on the reading list so they can learn about irrational beliefs and change them bit by bit. Or someone may have got a lot of the other parts right but really need some exposures that are very specific to their particular fear. And so there's so many elements to this that we have to pick away from all angles. When you're dealing with a disorder like OCD, it's very resistant, likes to keep the pressure on, pumping away, doesn't like to release its grip, it sort of latches in there. And that feels very much what it's like in the brain. It's like a sort of tentacle, like an octopus, that's sort of locked in one place and it just stays there. And then you go about your life normally and it's still locked in. And then only when that releases do you feel that real freedom. But so few people often ever do that they always think that that's as good as it gets, which it isn't. Now, in relation to questions, let's go to some of these questions first. I'm completely off topic with this future of OCD. That one in relation to harming somebody and needing to check if they're a stranger, that's relation to harm OCD. There's lots of videos on the YouTube channel in the playlists in relation to harm OCD. To get under that, it is the unconditional self-acceptance that's needed. So you see that you do not need to change things with them. It feels like you do, but you don't. And it's that chasing that's keeping you stuck. You don't need. That's the thing that's latching you in there. Just in relation to the questions, I can't answer every question on here because we get a lot of questions coming through, and this is the same as with the DMs on the Instagram. We get hundreds and hundreds of messages a day. It's really, we get a huge number of messages because OCD is a disorder, it's a doubting disorder. People doubting all the time. If I send one answer to one question, 5 more come back. So we can't answer DMs, and we can only answer some of the questions on these Instagram lives. We try to answer most, but we can't answer them all, and we can't answer broad ones like what is OCD or what is unconditional self-acceptance, because it takes too long to explain it in this. So we've got all our free YouTube resource, tons of videos on there, and the Facebook group. So there's loads and loads of free resources there to help get under that. Because with the number of DMs we get is a huge number. So we deal with primarily with appointments for the one-to-one and the group settings, for the group sessions, and then any questions that you have specifically that you want to ask those in the Facebook group or in the comments on our social media pages, and we'll try and answer them, or one of the mods will try and answer them, but we can't guarantee we answer all of them just because of the number that we get. Let's have a look here. Now, in relation to OCD knowledge, how important it is, it's a fine line, it's a balance. You need a certain amount of the knowledge, but you need to not go overboard. What tends to happen is people do go overboard, like, I need to know more and more. I can't miss one post. If I miss one post, I won't recover. I've got to get every single part there correct and understand everything, or I'm going to be trapped like this forever. There's a fear of fear element in there. So you need to watch the video on fear of fear on our YouTube channel. It gives a good breakdown of that. So I think that's a very important element. Otherwise, it's just a vicious cycle of constantly, have I read enough? Have I read enough? Have I read enough? And that can happen, that compulsion. Relation to guilt, chronic guilt never has a purpose. There's no benefit to chronic guilt, but we stay in a chronic guilt cycle because we're not accepting ourselves. We've got conditional self-acceptance. Conditional self-acceptance makes us be this like judge and executioner, where if I've done that, I'm written off, and then that back and forth cycle. Unconditional self-acceptance in the teachings of Albert Ellis, the first 2 books on the reading list, How to Stubbornly Refuse to Make Yourself Miserable and Myth of Self-Esteem, that Momin is often mentioning in there. And thank you very much, Momin, for commenting on these videos. Moderator helps out a lot there with these and posts all of the different things in the reading list regularly. It's very important you read those books. If you don't do the reading, it's very difficult to get better. Very difficult. You won't see it. You can't just kid yourself and say, oh, I can accept, I can accept. You need to see it. You need to see it to believe it. So the reading list is vital. And those first two books by Albert Ellis, How to Stubbornly Refuse to Make Yourself Miserable and The Myth of Self-Esteem, vital reading for OCD recovery. In relation to that question there about psilocybin, yeah, that's very much what's happening. In the future, it's that we're moving away from the image of viewing psilocybin as some kind of hippie, which is no negative connotations in these words, but just how people tend to view it. People tend to view it as some sort of hippie, weed-smoking drug that's for people that just want to sit taking drugs. That is an old stigma view of how people tended to view marijuana and cannabis. Psilocybin is in a different thing. Although it was used as a recreational drug, it had its huge benefits in sort of opening up our eyes to really see a change in perspective. So it's going to be very important in that, and we're moving away from that now. And so that's going to have a significant difference. As we've moved away with a lot of cannabis use for treating things like for reducing symptoms in MS and so on, and other medical and neurological problems. So we are changing on that. So we're in a time now where society can really accept that and adopt that. And that's why I think psilocybin is going to be very interesting to see what it does over the next few years. Do I think OCD is genetic? I imagine that there is a biological element. I would think so. I don't think it's learned alone. I think it's got a biological element that's there, then plus the environment shapes it. Or the environment doesn't shape it much and the biological element's strong enough to just come through anyway. The science is still out on that. I think we're going to find out a lot more about that over the next coming years. But it's something like that. I mean, you do see identical twins where one's got OCD and one hasn't. You see it in families, people's brothers and sisters having OCD, parents having OCD, and so on. In relation to sexual orientation OCD and HOCD, we've got a lot of videos on HOCD on the YouTube channel. If you check that out, OCD Recovery Channel, there's quite a few on there. Yes, acceptance, that's right. We can't rely on just technology and we can't rely on just medication for OCD recovery in the future. I'm not talking about now. Now we've very much the tools, all of acceptance and everything we need. We have to apply all of the changes in thinking we can. But in the future, you can't rely on it just being technology and medication. I imagine you will still very much have to still work on changing your thinking. We're not robots fully yet, so I think that's going to be very much the case. I think that a lot of those questions, if you actually look, a lot of the questions are asking about what's a compulsion, when's a compulsion, what's a reassurance, and so on. It's a lot of people do understand when they're doing those. They understand when they're in that cycle, but they still do it anyway. And so it's about being aware of that and holding yourself accountable and taking a step back and saying, well, where is this getting me? Is this getting me where I want to get to? Is this getting me towards the life that I want? Because people come into me all the time and they say, Rob, I don't want reassurance. And then they ask me reassurance. Or they say, I know I shouldn't ask this, but why are you even asking it? That's like going into rehab and saying, can I have some heroin? I know I shouldn't take it in here, but has anyone got it? And asking the medical staff. No, that is not the answer. You've got to hold yourself accountable. If someone goes into a rehab, the idea is to come off drugs. When someone comes into OCD recovery to get better, they are in a position where they are trying to, what they're trying to do is they chase, like a drug addicted to a drug, they're chasing certainty. So they're constantly chasing getting that relief of certainty. When they can't get it, the certainty doesn't exist. they then keep chasing, keep chasing, keep chasing, keep chasing. And that is the cycle. So you really need to hold yourself accountable and wean yourself off that certainty addiction, that chasing for reassurance. Because no matter how many people say to you, no, you can't have it, you shouldn't have reassurance, you've got to relax and as best you can and feel the anxiety for now and work through what you're learning and try and relax the body as best you can whilst you're dealing with it. You're going to keep going through that cycle, keep going through that cycle, keep going through that cycle. And you've got to stop that, because you'll always find another therapist, another forum, another person to ask for reassurance, and they're not always going to be as firm as me. I often say to people, trying to get reassurance from me is like trying to buy drugs off the police. You're not going to get that, because I'm very aware of how counterproductive that is. And what's the point of trying to get people better if you're giving them the thing that gets them worse and gets them stuck? So you can't do that. I'm going to be back on here on another Instagram live, doing question and answers, covering a lot more of your question and answers. Went a little bit off topic today on the future of OCD, and I will be doing specific videos all on what is the future of OCD is looking like, and things that I think are interesting for you guys to know without going into too much of the sort of technicalities of it, but stuff that's sort of more broad and interesting to hear, because otherwise that can become compulsive, wanting to hear more, what's going to happen, what's going to get me better, in that sort of clinging, chasing recovery. So we've got to be careful of that too. All right, guys, great to see you on here. I'll be back on another Instagram live shortly. See you guys. Take it easy.